the state's rollout of 988 and the Crisis Hub. Dr. Howat was most recently the founder and former executive director of Beacon Community Connections. She also previously worked as the first executive director of the Lafayette Parish Criminal Justice Coordinating Committee, and before that as the project director at the PCARD Center for Child Development and Lifelong Learning in Lafayette. And as you can imagine, today's topic on mental health is especially important as we approach the holiday season. It's a time of year when more members of our community depend on mental health services. So our usual reminder, if you don't mind, at the end of Dr. Howat's remarks, only members of the Baton Rouge Press Club and the working media are allowed to ask questions. So please join me in welcoming Dr. Holly Howat.
All right, thanks, Ryan, and thank you all for inviting me to be here. I'm really happy to join y'all today. And just a little bit more about background about me. I am originally from Dallas, and I moved to Lafayette about 22 years ago to get my PhD. I met my husband, and I've been in Lafayette ever since. As Ryan said, I've done a variety of things, and one of the first places that I came in contact with the mental health crisis that we have in our country and in our state is in my role as the executive director of the Criminal Justice Coordinating Committee for Lafayette Parish. And while I was there, the committee really struggled with what to do around the issue of the over-incarceration of people with mental illness and substance use. For many years, and continues in our country, a lot of times the only place someone can access any level of care for their mental illness or substance use is either the jail or the emergency room. And neither of those are good places to try to gain mental health stability or to gain a life of sobriety. And so the work that I did there really led me to launch Beacon Community Connections, which was a social care nonprofit that worked to connect people to community resources. I did that work for about 8 years, and then was stepping back when Secretary Greenstein offered me the position of interim assistant secretary at the Office of Behavioral Health. And I was excited to take on this role because I really felt like it was a time that I could make a difference using all the information that I learned and my experiences to improve access to care, because I really think that's what all of this work is, and that's what I'm going to talk about today. The Louisiana Crisis Response System is we have too many people in our communities that suffer from untreated mental illness or untreated substance use, and we need to do better as a community with that. Just as a little bit of a background, sometimes mental illness and substance use gets stigmatized as something that happens to poor people. And I'm just here to tell you that mental illness and substance use, it crosses every race, every religion, every socioeconomic status. It's not something that happens just to poor people. And so I really want to work hard to dispel that myth. Right now, in our country, anywhere from about 20 to 25% of people have some type of mental illness going on right now. So in Louisiana, that's about 1 million people. So just think about that for a minute. There's about 1 million people in our state that have a mental illness. And while nationally about 50% of them have accessed treatment in the last 12 months, in Louisiana only about 30% have accessed treatment in the last 12 months. So we have about 600,000 people in our state that are walking around with some kind of mental illness. It could be depression, it could be anxiety, or it could be something very serious like schizophrenia or bipolar, and they're not getting the treatment that they need. As I have gone around the state as part of my new role as Assistant Secretary, I should mention this is the first day of week 8 on this job. I've been listening to the stories. I was most recently at Capital Area Human Service District this morning, and just listening to all of the work that is being done. And we are really working hard in a lot of different ways to move the needle on this, and I think we are, but I think we really need to recognize the problem and the implications of that problem. So the problem with 600,000 people in Louisiana not having their mental illness treated is that mental illness does not go away. So it's just gonna stay there, it's gonna fester, and it's gonna grow, and it's gonna get worse, and it's gonna tip over into a crisis. So recent Medicaid data indicated that 25,000 people visited the emergency room for behavioral health reasons last year. That's a lot of people. And unless they're a danger to themselves or others, they cannot be compelled into treatment from the emergency department. They'll be assessed and released back into our community. Think about it also, all these untreated people, when they call 911, that's a 911 dispatcher, that's an EMT transport, that's law enforcement coming out, that's jail, they may be being jailed for minor things. All of these things relate to the problem that we need to solve. So the question really is, how can we identify and guide people to more effective mental health resources to reduce the burden on our first responders and on the emergency department? And that's something that Louisiana Department of Health has been working on since 2018, and what they have been building and are building, and we will continue to build, is the Louisiana Crisis Response system. And so this is work, like I said, began in 2018 with really looking at what the problem is, looking at what best practices are. They are building a continuum, or we are building a comprehensive continuum of care based upon SAMHSA's National Behavioral Health Crisis Care Guidelines. SAMHSA stands for the Substance Abuse Mental Health Service Administration. And so they talk about 3 pillars to this work. The first pillar is someone to contact. So when a crisis happens, having clear channels for someone to contact. I'm going to go deeper into what Louisiana is doing in these regards, but let's just talk about the pillars for a second first. And it needs to be immediate, accessible support. So that's someone to contact, a place to call. Then we need someone to respond. So we need some people to be able to go out and deliver services or bring people to services. We need places that can provide crisis care as well as post-crisis and even moving upstream into preventing crisis. So someone to contact, someone to respond, and then a safe place for help. So what we need is a wide array of stabilization services for behavioral health crisis and for emergencies where people can receive immediate treatment and support, as well as services that can aid in prevention and post-intervention. And so those 3 pillars are what guided the development of the Louisiana Crisis Response System. And so I'm going to go into a little more detail on each of these pillars and what we're doing today. So the first one, we think about someone to contact. So like I said before, people are very familiar with 911. Well, there's a new number in town. It's called 988. And 988 is a national initiative similar to 911. It was formerly called the National Suicide Hotline. But in July of 2022, 988 was rolled out across the nation, and including in Louisiana, as a place where someone can call or text and get a trained crisis specialist that will work on crisis de-escalation and providing emotional support. So how do you know whether you should call 988? Well, the way it works is you decide if you need 988 or not. If you feel like you're in a mental health crisis, whatever that may be, you should feel empowered to call or text 988. And that relieves some of the burden off of 911 and allows emergencies that need an ambulance or law enforcement to come out. So in Louisiana, we have 2 call centers that operate, one in the northern part of the state and one out of New Orleans, that blanket the entire state to serve our system. So since that time, the call volume continues to grow, both calls and texts. And so in the last quarter, the data indicated that we're exceeding 4,000 contacts every month. When you call 988, it's confidential. You can remain anonymous if you want to. It's available 24/7, 365. And so as we're talking about the holidays coming up, this is a great number to have handy because holidays are stressful. Let's just be honest. There's these expectations that we place on ourselves and others. Sometimes we're around family members or family dynamics that can be triggering to us. And so 988 is a great resource. A newer resource that we launched this year is the Louisiana Crisis Hub. So this is similar to 988, so we're still talking about someone to contact, but it has an enhanced purpose. It really is going to bridge that gap between someone to contact and someone to respond. So you can call the Louisiana Crisis Hub if you know you want someone to call out, or you know you want to go to a place. So they have mobile crisis response units in all the regions that they're able to then dispatch to come see you wherever you are. This could be at your home, this could be at your work, this could be at a community center, wherever you are. So the crisis referral specialists that come out there, they're also trained in crisis de-escalation. They can triage, they can transfer you to other facilities, and they're working with our Medicaid managed care organizations. They're working with 988 and other local partners. Again, this service is also available 24/7, 365. The key difference is 988 is I just want to call for someone to talk to. Crisis Hub, I need someone to come out and help me, or I need to get to a place where I can be helped. That one has a slightly different number. It's 855-242-2735. I should mention right now there's swag on the table that has both of these numbers that you're free to take with you. So October of this past year marked the 6-month mark of the Crisis Hub being activated, and since that time, from the beginning until October, we've had about 700 calls to the Louisiana Crisis Hub. You're probably going to be hearing more about this as we continue to roll this out and roll out more marketing and awareness campaigns around that. So that's our someone to contact. There's 2 ways to get in contact with someone. Now we're going to move into someone to respond. So someone to go out. Now I kind of mentioned how the hub is kind of serves as a bridge for that. So we do have mobile crisis response. Mobile crisis response is where a trained team deploys to a person's location, and they provide relief, resolution, and intervention. And so there are mobile crisis units specifically for adults, and there are mobile crisis units specifically for children and youth. Again, these services are available 24/7, 365. And so the mobile teams, while everyone is trained, they're made of both licensed and unlicensed mental health professionals. So they might have a counselor or a social worker along with a peer support specialist or a community health worker to go out there. And they can be deployed in just about any setting. And then as the service has evolved, this service actually really started back in 2022 for adults and 2024 for children. They're including more and more locations, and so many emergency departments also allow these mobile crisis units to come in and handle the patients within the emergency department. So that's someone to respond. And then we have, our last one is a safe place for help. So that is a place where someone can actually go to get some crisis services. And that is a brick and mortar facility where individuals can either walk in or they can be transported to. And so the Baton Rouge area is so very fortunate to have one of these places that's already been up and running for several years, and that's Baton Rouge's Bridge Center for Hope. That's an example of a behavioral health crisis center. So these crisis centers, they provide an initial response. They're providing, again, like I said, relief, resolution, and intervention outside of the person's home. So again, services are available 24/7. 365 days. Someone can stay there up to 23 hours as part of the behavioral health crisis care. Now the Baton Rouge Bridge Center for Hope, they have additional services and supports that are available, but the part of Bridge Center that is just the crisis care, someone can stay in there for 23 hours. And again, it's for adults. So we are continuing to grow these programs. There is many regions still don't have an actual brick and mortar facility yet, so we're working with several regions to move in that direction. But in the regions that do have that, they're exceeding 300 referrals or 300 services per month. And so we're continuing to work on a statewide distribution of these services. And again, this is going to decrease the need for EMS, ambulance services, or law enforcement to respond to these crisis calls, because we'll have special trained mental health professionals responding and a place for them to go. So we talked about the crisis response, and the crisis response it's great. It's very much needed. We need to have a crisis system in place because people are getting into crisis. But eventually, what we want to do is also build up prevention and postvention, or after crisis care, or an array of services, so that hopefully people won't have to tip into crisis in order to get care. And so some of the other services that are follow-up services that are being provided are community bereaved crisis support. So this is ongoing community-based follow-up after an initial crisis response. So it could be a mobile health team, or it can be telephonic. They can follow-up can occur up to 15 days after the crisis response, and it can also be provided to individuals who end up going to the emergency department that they identify. They can be referred to that. The service is available for adults as well as children and youth, and it can also encompass the whole family, because sometimes when there's a crisis, one person is acting out, is in crisis, but really the whole family could use some services and supports. And then there's crisis stabilization, and so that's just ongoing support for individuals in crisis that needs to take place if they need to stay outside of the home. So this is overnight services where they can stay 3 to 5 days, and really if they need a longer time to get stabilized and back on the right road. Services in this way, they're voluntary, and they're available to someone that might be at risk of being hospitalized or institutionalized. So hospitalized, someone that might have to go to an inpatient psych unit, they might choose crisis stabilization again. And again, it might be an alternative to incarceration for nonviolent, people that are accused of a nonviolent offense. This service is really available to people that are 21 and older. And so that's kind of, in general, Louisiana Crisis Response system as it is right now, and like some of the additional services like for after crisis. I just want to kind of close with kind of talking about how LDH has supported and is supporting and will continue to support that. So beyond just like developing these programs and working to get them up and running across the state in every region, LDH is also supporting this system by providing training and technical assistance through a partnership with the Center for Evidence to Practice, which is through the LSU Health Science Center in New Orleans. We also, if there are crisis providers that want to start one of these services, there's financial support for startup and transitioning to becoming operable, and even to becoming operable on a 24/7 basis. There are reimbursements for these services, and we're working on reimbursement for the non-Medicaid population. So there are Medicaid rates that are reimbursable, but like as I said in the beginning, mental illness, it knows no socioeconomic status. It doesn't care what your insurance is, and so there are ways that we are working to fund that if someone is non-Medicaid. And so we are watching and watching the system mature, and as service utilization increases, we want to be able to increase the amount of providers that we'll be having. So there is a lot more that I could say, but I'm happy to entertain questions about the Crisis Response Center. Yes.
Two unrelated questions. Agriculture Commissioner Mike Strain last week was making a presentation and said that there is an unusually high number of farmers that commit suicide. And I wanted to know if you had any insights into that, number one. Related to that, are the rural areas of Louisiana underserved? And my understanding is that SAMHSA and LDH are working to get a grant for CCBHCs and their growth.
Yes. Okay. So let me see if I can take this. Yes, I do. I don't have any data on that, but I do believe that farmers do sometimes have a higher rate of suicide. I think they attribute that to sometimes the social isolation and loneliness that comes along with being a farmer. Rural areas is a challenge. Almost our entire state is under a health professional shortage area for licensed mental health professionals. It's a constant challenge. I do think that the Louisiana Department of Health is working diligently to address that. We are aware of that, and really working to find ways to support those local communities that are more rural in nature. I do feel like the Rural Health Transformation Grant is going to be a great opportunity for our state to have federal dollars come in to be invested in our rural communities. Because geographically, over half of our state is rural. And I'm sorry, you asked about CCBHCs. So CCBHCs are, LDH loves an acronym, and I'm blanking on, I think it's Collaborative Care Behavioral Health Clinics, for those of y'all that are not in the know. And basically, what a CCBHC is, it's a model of care where a person that has a mental illness or substance use, they can get both their behavioral health and their physical health care in the same location. So, I was just at Capital Area this morning, and they have, it's not an actual CCBHC, but it's this similar model where they have a health clinic right downstairs from their mental health clinic, and they also have a pharmacy all in one building. And so I met with a lady this morning, and she originally started coming to Capital Area for some mental health issues. She's been faithfully taking her psychiatric medicines for 20 years, and then more recently, when the health clinic opened, she got in down there and was diagnosed with hypertension, but now she's able to also get her blood pressure medicine at the same place. And so she feels very comfortable with the staff there. She has a high level of trust. She feels like at that clinic they understand her. They're not stigmatizing her for having a mental illness. And so it's a very beautiful model, and I'm very excited that Louisiana has gotten some planning grants. We're gearing up for a demonstration, to apply for a demonstration grant, and hopefully we'll be successful in putting this model in throughout the state. Did that answer all of your questions? Okay, thank you. Yes.
I know that when science back in the 70s, I knew the statistics was like a third of the people in the United States mentally ill. I have a twofold question. What's the number today in the state or the United States of mental ill, because I see a rise, and also autism? The autism involved in the program as well. I know that's a developmental disability, not a mental disability. It looks like there's a move to integrate the two. What's your take on that?
Sure. So the statistics that I have pulled from SAMHSA, different places have different statistics, is about 20 to 25% of anybody across the nation could have a mental illness, any type of mental illness. And so if you go around with that number, that's about 1 million people in Louisiana right now. that have some type of mental illness. And so, speaking about autism, so autism does fall under the Louisiana Department of Health and under the Office of Citizens with Developmental Disabilities. One of the things that we've been talking about is the co-occurrence of someone with some kind of developmental disability like autism, but it could really be anything, and mental illness and substance use. And it's really been hidden for a long time, and it's something that we want to do a better job on meeting the mental health needs of people that have disabilities. I think there was a question there.
With the PTSD and mental illness, and of course there are people that come out of incarceration and come back into just a regular lifestyle. There's a lot of cases with that going on, people, when they come in prison 10, 15 years and they come out, they some of the people that's calling for help.
So there's a couple of things. So in my previous role at Beacon Community Connections, we worked with the Department of Corrections on reentry programs, people coming out of jail or prison that needed help getting back reintegrated into society. And I can tell you, in people that are incarcerated, they have an even higher prevalence of mental illness and substance use than you see in the general population. So it's very important to address those things when they're coming out. A lot of times, if they've been in a state prison, they've gotten services for their mental illness and their substance use, and they're in danger of losing that when they move back into the community. So it's very important to make sure that it's a seamless transition. So one of the things that Louisiana Department of Health is doing right now is we have applied for a Medicaid 1115 waiver. That is a type of waiver that allows, it's kind of outside of what normally the feds allow Medicaid to do. And so what we're wanting to do is start when an inmate is about 3 months or 90 days prior to release, getting them enrolled in Medicaid and making sure that Medicaid is active and they can start working. So if they were taking medications, the first day that they're out, they're able to access those medications. If they were getting some type of treatment, the first day they were out, they're going to be able to get that. So we're working to submit that to the federal government and hopefully have that approved in the very near future. Yes, and then I'll, yes. You and then I'll go to the orange. Yes.
Are there any plans to have workshops about all 64 parishes in our state sharing the data you have?
Well, I will say that I'm personally going around right now meeting with all the local governmental entities. So each region, I've been to Central Louisiana, Northeast Louisiana, South Central Louisiana. I was at Capital Area today. When I leave here, I'm heading over to Hammond to talk to the Florida parishes. So I'm working on going out and listening. And then my goal is sometime in the spring to go back to each of these regions. And I don't know if we can go to each 64 parishes, but at least each region and talk about the great things that we're doing at LDH. So you had a question?
Yes, you mentioned 4,000, but I didn't catch what 4,000 was.
4,000, that's the number of 988 calls, chats, and texts that we receive every month for the last quarter.
Every month.
Every month.
And,
Mhm.
and that's from Louisiana.
In Louisiana, yes, this is Louisiana.
And since you're starting in 2018.
No, well, it's been growing. So when we looked back at the last quarter, so that would have been July, August, September. That data, that was how many contacts. That was an average of the contacts was over 4,000 per month. Yes. Hold on. You were next, and then I'll get to you. Yes. You had a question? Did you have a question? No, the one next to you in the glasses. Yeah. No. Okay. All right.
I have a bad memory problem, so I want to ask it before I forget. And it was looking at somebody that I've known since she was born that gave me the courage to ask. prescribed. But I finally saw a doctor, and the only thing I got right now is Medicare. Okay. And I finally see a doctor who's legally trained. Okay. And he looks me dead in the eye and says, based on what I've been doing and how long I've been doing and how long I've done sometime right here at this restaurant, he looks me dead in the eye and says, Mr. Jackson, I think it's time for the Louisiana legislature to come sit on this couch. Come on.
I don't know what was the question?
Well, the question is, how do you mass report that the Louisiana legislature needs to seek your services?
I guess it's, at this point, seeking mental health treatment is voluntary.
Can the Louisiana legislature, can I make a 90-day call and suggest that Republicans and Democrats in this legislature need to go see some psychiatrist? If they won't do anything about a law that for 12 years I've been trying to get them to change, the people, finally a young Republican, the voice of the tigers, tried to do something about it, and the answer that I get from him is that I can't get Democrats to go along with it. And it's going to hurt them more than anybody else if this is ever successfully implicated against our interests.
I think I'm going to have to respectfully no comment to that, and then you, and then you.
My question has to do with your relationship with the medical school in New Orleans. I wanted to know if there is any discussion at that school about providing additional training for the internists, the family physicians, in greater detail in sight because of the immense lack of psychiatrists and the number of social workers in our state. It is shocking.
So I have not personally had any conversations yet with the medical schools. That is a great idea, and I'm definitely open to talking with them. I'm always a fan of more education. I think definitely we need more education around this. And I think all of our mental health professionals and physical health professionals should have some kind of training with this. Yes, that's right there.
With the potential roll-off of thousands and thousands of families from having health insurance starting next year, will that impact your funding? And I'm assuming if I'm a parent of a family and all of a sudden I don't have insurance for my spouse and children, I'd be pretty depressed. But besides that, from a funding standpoint, will that not affect your operation?
I would say that's kind of above my pay grade about fiscal forecasting on that. So I'm just I don't think I could intelligently answer that question. I'm sorry.
You mentioned the Ridge Center as one of the brick and mortar places. How many other brick and mortar places are there in the state?
Let me see here. So there is one in Region 1. That's the New Orleans area. There is one in Region 6, which is Central Louisiana, and then it looks like there's one in Region 7, which is the northwest part of the state, Shreveport-Caddo area. The rest of them, there's a request for applicants open, so if you know of an organization, we would love to work with them and support them on getting those services up and running.
Do you know how they are funded? Because the one here in Baton Rouge is funded because we passed the tax. So do you know how the others are funded?
I do not have that detail of information on that.
Thank you.
Can I follow up on his question? Are you lot of people no longer have access to their insurance. Are you concerned that they'll do what you said at the very beginning, and that's they'll get their services at the emergency room or a jail, and it'll be much more expensive for everybody?
I think that is a possibility. I don't know that it's a probability, I guess is what I would say. Mhm.
Two questions. One, how much money in your budget comes from the federal government? And second, mental illness covers a broad area. Can you give a little breakdown on the types of mental illness and percentages rather than just lumping everything into one big category?
I do not have, so as far as the first question, I don't have like the exact facts and figures about how much is federal and how much is state generated funds with me. As far as the breaking things down, I think, and I'm going off my head, that I think it's about 8% of people have what's called a serious mental illness. And so that would be something like schizophrenia, some kind of psychosis, bipolar, those kinds of things. And then the rest would be a more common depression, anxiety, adjustment disorders, things like that.
Like PTSD, drug related, I mean, you've got
So
a lot of things lumped into one word.
substance use is different, though. It does get lumped in when we talk about behavioral health, but that's about as defined as I can get. Is about 8% have a serious mental illness, and if we say 20 to 25% have something else, then that's going to be 12 to, I'm trying to do math in my head, I was not a math major, 12 to whatever, 17%, something like that. Yes.
Is there a special process you have for working with schools? Do you work in schools, with other schools, private schools?
With working with schools, schools is kind of at a regional level. I will say, when I was at Capital Area this morning, they have a very robust relationship with several of the parishes that are in this region. I think it was, you're going to have to correct me, I think it was like 18 schools. They have Capital Areas providing counselors to go directly into those schools and work with them. And they're just doing really great work in there. I did get to speak briefly with a grandmother of 2 children that are receiving counseling services through the schools. Through Capital Area, and she was just so thankful and so impressed with the work that's being done and the care that is being shown to her grandchildren. Okay. All right. Thank y'all very much.
What do you